My name is Dr. Na Ashley van der Boydonten.
Hi, I'm Aisha Saint Cyr.
My name is Penelope Agbai.
So my name is Alex Boache.
My name is Joshua.
My name is Gideon Kobi Achaka.
Hello, my name is Ruby.
My name is Ankara Israel. I work with West African
AIDS Foundation.
AIDS Foundation.
West African AIDS Foundation is a great place to be, whether you're in Ghana or you come from outside Ghana.
So WAF is actually an acronym, and it stands for the West Africa AIDS Foundation, and it's basically a non-governmental organization that was registered in Ghana in 1999. So we have been in existence for the past 14 years, and the organization was set up 14 years ago in Ghana as an organization to help reach out to the general population on issues pertaining to HIV and AIDS. At the time, there weren't enough of such organizations in the system. There wasn't any structured system in place in Ghana for education towards HIV, let alone anything to do with treatment of persons living with HIV. So over the years and today, what West Africa AIDS Foundation does is we try to champion Ghanaians in an effort to empower them in knowledge where HIV AIDS is concerned, but also other infectious diseases. We assist them in knowing their HIV status, and then for those who are HIV positive, we enroll them onto treatment at our on-site clinic. In Ghana, we aren't doing that bad when it comes to HIV, at least for the past, I would say, 5 years. The prevalence of HIV in Ghana has been declining. We started from around above 3-point-something%, and as we speak of 2012, our prevalence has dropped to 1.37%, which is quite low compared to other West African countries. About 280,000 people living with HIV in Ghana out of a population of about 25 million. And we have about twice the number of women as opposed to men. Currently, we have about 80,000 persons out of this 280,000 that are on antiretroviral medications. So HIV, as we all know, is a virus, and the acronym HIV stands for Human Immunodeficiency Virus, and it is a germ that when it gets into your system is able to destroy your immune system, making you get into a stage where you are not able to protect yourself against ordinary infections that surround us on a daily basis. So if you are somebody who is positive with HIV, meaning that you have an HIV germ in your system, what eventually it could lead to would be that it will lead to a condition that we call AIDS, which stands for Acquired Immune Deficiency Syndrome. And most of the time when we reach that stage, you will see that your entire immune system is depleted. You have absolutely no protection within you to protect you from illnesses that surround you. That is why in a country like Ghana, we tend to see a lot of HIV infected persons being also infected with tuberculosis, because tuberculosis is an airborne disease. It's very predominant in this country. Most people will be contaminated with the tuberculosis bacteria, but they don't develop the problem because they have a strong immune system. But those that are HIV positive and have a compromised immune system, they will end up getting the symptoms of tuberculosis. Modes of transmission for HIV are through sexual contact. So if a person has unprotected sex with somebody who is positive for HIV, there is a possibility that the person will be able to transmit the virus to this other person who is negative. Then we have, of course, the contaminated objects, where we have things like sharp objects, either a razor or a blade, or even contaminated scissors that people use to clip their nails, and all of those things that also account for about 5% of HIV transmission rate. And then finally we have what we call the mother-to-child transmission, which accounts also for about 15% of mothers who are HIV positive but are not aware of the situation, and then mostly during delivery will pass the virus to their infants.
With the same cup with someone who has HIV with the same spoon. You can do everything. You can only get HIV through sex, blood transfusion, through the use of sharp instruments, through mother to child. That's when you can get HIV. And also HIV can only be found in the blood, semen, body fluid, that's the blood, breast milk, and then the vaginal fluid. That's where you can get HIV from. That's where the virus, they stay and live at. So you can do everything. If someone has HIV, it doesn't mean that that's the end of that person's life. The person can live as long as God has asked the person to live. You can do everything with a person. How it can be diagnosed, HIV can be diagnosed unless you test. If one does not test, the person will not know that he has HIV. So everybody has to test. If you have some kind of signs and symptoms like sweat, a fever at night, you have to test. If you have diarrhea for a long time, if you have rashes on you which has been there for a long time, if you have body, you are always losing weight. If you do not test, you will not know. You shouldn't assume that you have it, or you shouldn't assume that you don't have it. You should always go and test for it.
This is the buffer solution. We put it on the sample, okay, to prevent the sample from going to the acidic or the basic level. There is a line. Now this test is showing negative, okay, with one line on the C. So it means the sample is negative. It has no antibodies specific to HIV, okay. So this sample is negative. But when you see any other line on the 1 or 2, meaning the person is type 1 positive or type 2 positive, okay. So when you see only one line on the C, meaning the person is negative.
Okay, we counsel them about their medications, and we also tell them how to take appropriate notice of each of the tablets.
Okay.
So we have here the Combivir, the Nevirapine, and then Lamivudine, the single dose, and we have the the combination, which is Nevirapine co-pack. And we have also here the Efavirenz co-pack, which are already here. This is what we do in here.
When you tell them their results, it's like they become so mad. They even don't know what to do. Some will say, oh, I'm going home to kill myself. I'm not going to come again. You people will not see me again. But after talking to them, they go, you call them, you talk to them on phone also. You'll be here about 3 days, 1 week, they are in. Okay, I'm coming for treatment. And you can see that the talking and the conversation you had with the person try to change the person. So the person comes to take treatment.
It was actually a couple, a female and a male, and I provided psychosocial support for them. It was very hard because the woman came in and she was positive, but the husband didn't know, and the husband said if he tests positive, he was going to put it on the internet that the woman is HIV positive and put her picture there. The lady didn't want to be with him because she wanted to move on, so it was really hard, providing psychosocial support. But it went well. He tested, and now he's a patient in our clinic, so he comes often to get his medication. So that was a very interesting and impactful time with the HIV patients.
For instance, I've had a pregnant woman who was newly diagnosed to be HIV positive coming in to tell me that she wasn't very surprised that she had tested positive, because just a few months earlier on, her pastor had picked her out from the congregation in church and had told her that he had had a vision that her mother-in-law, that's her husband's mother, had injected her with coconut water in a syringe, but that had also HIV virus in it. So he was of the impression that very soon she was going to be HIV positive. And now that it had come out that she was HIV positive, she knew it wasn't something from this world, but somebody had spiritually inserted HIV into her blood. This is about a lady who found out that she was HIV positive when she was expecting her first child. During her prenatal screening, it was detected that she was HIV positive. She was one of the bold women who was able to go and tell her husband, and that was when it was detected that her husband was not HIV positive, so he was HIV negative. Luckily for her, he remained very helpful to her. He remained very, compassionate, and actually stayed with her. And I think that is really what helped her a lot go through all the difficulties. Initially, it was very difficult for her. She didn't understand where she had, acquired this infection from, as her husband was negative. She was pregnant at the time, so there was a lot of emotional stress for her. But at the end of the day, with the support of her husband, she was able to go through the pregnancy and the delivery quite successfully, and through the prevention of mother-to-child transmission effort also, her child came out negative. And after that, she has had 2 other children that are all negative, so she now has 3 children that are negative. She herself is positive. Her husband has still remained negative. But the most interesting part is that through all her experience and the encouragement she has received from WAF, from IACC, from her husband, she has been able to build herself up to become a counselor, and of late she actually works with IACC twice a week, where she uses her experience as an HIV positive mother who has been through 3 pregnancies that have been successful, and her kids are all negative, to empower the other women who are also HIV positive, coming now for interventions to try and protect their children. So she is actually using what we call the model of hope. The model of
what they do is great for the community. They help people in need, and I think it's a good way to help others who cannot help themselves. And they work with HIV/AIDS to help mitigate it, so it's actually important.
The belongingness, how the staff members relate with each other. If you might belong like in a family, coordinate hand in hand to work to bring efficiency to whatever we put our hands to.
I think WAF is a great organization. We've helped so many people in terms of patients with HIV, giving them medication, providing them with psychosocial support, empowering individuals with HIV and AIDS.
It is riding on a higher pedestals as it stands now, looking at projects that we've been engaging, looking at advocacy issues that we've been engaging, looking at trying to provide quality treatment when it comes to issues affecting people living with HIV. So I think that West Africa AIDS Foundation has been very great. They've been very impactful to the society.
I'm really seeing a lot from here, because the truth is there is someone who will say I work in a hospital but do not know much about HIV, AIDS or STIs or all kinds of things. I'm here to do all this. I have the, me being here, I've got the knowledge to do all those things, take care of everybody, counsel and do all.
They are normal people, just like us. They eat well, they take their medications, they live a normal life, they can live longer. So I don't think there's anything wrong with being affected with HIV/AIDS. It's normal, they're just like us.
And what makes me happy is to see that these people live healthy lives. They are responsible, they have the hope of living stronger. Some even get married and give birth to children who are negative. And I want people out there in the other world to know that when you are HIV positive, it doesn't mean life has come to an end. You still have the hope to live longer life and productive life. worldwide as well.
Or even for that matter, where to go for additional assistance for any other help that they may be needing.
And after my internship, I chose to stay for a year. And then after staying for a year, I chose to work here.
It was very impressive to see someone's mind change from commit suicide and killing themselves to understanding that they can live healthy.
Improve the lives of the minority in the society. So when I came across the mission and the vision of WAF.
My name is Penelope Agbai. I work in West Africa AIDS Foundation as the Health Communications Officer.
West African AIDS Foundation is a great place to be, and I want all of you out there to come join us work.
Because they are doing so good, they are helping our nation as a whole, and they are making people to know their status as well.
They just have to take the medication, they just have to eat well, they work, they can do all the things that